Good evening. My name is Lyle Staub, and I'm the governor of Rotary District 6440. We welcome you to this Rotary Town Hall on COVID-19 in Illinois with Dr. Ezike, the director of the Illinois Department of Public Health. This event is being broadcast on YouTube Live. Recordings will be available on both YouTube and on the Facebook pages of our three districts. I'm joined today by my fellow governors, Tom Brooks of District 6420 and Chuck Corrigan of District 6450. Together, we represent 172 Rotary clubs and 5,200 members in the northern third of Illinois. I'd also like to introduce Pat Merriweather-Argus. Pat is Director-elect of Rotary International, and she is a member of Rotary's COVID-19 Task Force. Chuck?
Thank you, Lyle. It's my pleasure to introduce our featured speaker tonight. We're honored to have Dr. Ezike, the Director of the Illinois Department of Public Health, with us tonight to speak to COVID issues. Dr. Ezike is a board-certified internist and pediatrician. She graduated with honors from Harvard College, and her medical degree is from the University of California at San Diego. Dr. Ezike served for over 15 years with the Cook County Health Department, promoting its mission of delivering health services with dignity and respect, regardless of a patient's ability to pay. As medical director for the Austin Health Center, located on the west side of Chicago, she engaged with the community through health initiatives involving obesity, diabetes, breastfeeding, and other common health issues in that community. Dr. Ezike's career is marked by her delivery of health services to those in our community who have the greatest need and the fewest resources. We are grateful to hear from you tonight, Dr. Ezike, and we look forward to your remarks.
Thank you so much. I'm trying to turn on my camera. It says that the host has not enabled it to be on. So if anyone's able to change that, that's fine. Otherwise, hopefully you can hear me. So hello and good evening, Rotary International. It looks like I can turn it on now. Thank you. Thank you, District Governors Bruce Baumgarter, Tom Brooks, Chuck Corrigan, and Lyle Staub for the invitation to discuss all things COVID-19 tonight. I want to talk specifically about the vaccine, and I want to thank the many Rotarians that have given of their time and energy to help with COVID-19 efforts. I'll keep my opening remarks super brief because I want to answer as many questions as possible in the time allotted. But I'd like to begin with some facts about the three COVID vaccines that Illinois is administering across the entire state. First of all, it's important for everyone to know that all three vaccines are safe and effective, free, and all necessary to end this pandemic. If you want to comfortably see your family and friends, you should plan to get the vaccine. I have been vaccinated. I felt some general soreness in my arm, but I didn't experience any other side effects. The process was safe, it was fast. I took the COVID vaccine so that I could hug my mother again, so I can have peace of mind. I encourage everyone to get vaccinated. Again, there's no cost to you. And if anyone is soliciting a fee, please run away and also report that to the authorities and report that to the Department of Public Health. So for all who are in the 1A category, the 1B, the 1B plus, all of you Illinoisans that fit that, please make an appointment. Go to coronavirus.illinois.gov/S/vaccination location. But we've also set up a call center for people who are having difficulties with the online scheduling using the internet. Please call 833, that is a toll-free number with the area code 833-621-1284. So I'm going to end with a call to action. Aside from getting yourself vaccinated, please help a senior, help a neighbor, help someone get an appointment. The more people we get vaccinated and the faster we get them vaccinated, the sooner we end this horrible nightmare, which we have known as the COVID-19 pandemic. So I will stop there and open it up, turn it back over to you to lead out with the questions, please.
Thank you, Dr. Ezike. A town hall always includes a question and answer session, and we gathered some questions from our members. So here's the first. We know that there are some people that do have a reaction to the vaccine. How is that tracked?
Right. So the reactions in terms of the soreness, which are expected, the body aches, some muscle pain, joint pain, like that's expected. I think you may be referring to the anaphylactic reaction that we heard about that can occur. So just to be clear, that has happened about 4 times per million doses given. So it is quite rare, but even still, all precautions are being taken to prepare for such a reaction, despite how uncommon it is. And so for everyone, despite it being like about 4 cases per million shots, for every single person, there is a waiting period of at least 15 minutes to make sure that we observe for that reaction. And every site that administers the vaccine is equipped with the epinephrine, that's the quote EpiPen, that can be administered and reverse those effects. So again, we are observing for the possibility of that severe anaphylactic reaction, 15 minutes at a minimum, and have at each site the tool, the medicine with which to reverse that reaction.
Thank you.
Hi, Doctor. I saw recently that 50% or more of the 65 and older group in Illinois has now been vaccinated. Overall, what is our percentage of all our residents? And when we talk about age, how about those that are under 16 years of age? What can you tell us about that group too?
Great. Okay. So for the individuals over 65, 57% of those over 65 have gotten at least 1 dose. For the general population, it's about 1 in 4. It's about 26% of the entire eligible population have gotten at least one dose. We know that the vaccine right now is not approved. Of the 3 vaccines, there's one that the age range descends to age 16. The others are 18 plus. So we know that there are active trials happening now for the 12 to 15 age range. So our higher, our older, our adolescents, our older children, there are trials going on for that. At least 2 trials that I know of. I think one is concluding and another one is underway. And so we are expecting that before the end of the summer, we might have new recommendations that will lower the age to maybe the 12-year-old population. And of course, they're looking at additional studies for even younger. But as is always the case, you start with generally the healthier population, not kids. And then after that, you start doing the studies specifically in children and starting with the oldest of the children and working our way down. So that's the process that's happening now. And hopefully we'll have some information by the end of the summer about vaccinating kids as young as 12.
Thank you.
Dr. Tom Brooks in Rockford. We have a question about what is the best way to register if you don't currently have an appointment for your vaccine. Is there a central clearinghouse for that information, and how is that being handled?
Right. So that is a way that we can use that 833, that toll-free number that I shared, because if you call there, your name and your information will be taken. And so if they cannot give you an appointment right there, it will be put on a waiting list, if you will, for which it will be given to local health departments that are in your area, versus coming back and continuing to look for a slot and coming back to you with the information. So that can serve as your quote clearinghouse to make sure
Okay.
that someone is working on finding a vaccine. Again, that number is 833-621-1284, 621-1284, and the area code 833.
All right, thank you.
Dr. Ezike, we've heard that a medium to high percentage of healthcare workers in hospitals and nursing homes are not taking the vaccine. What's being done to encourage the rest? And can healthcare employers require their staff to be vaccinated?
Right, that's a great question. So we know that healthcare workers were prioritized as the first group to be offered the vaccine. Again, when it was in very limited quantities, these were the first people back in right at the middle of December is when we started this effort about 2 months ago. Yeah, 2 months ago. 3 months now. It's been almost 3 months now. Time is flying.
Time flies, yeah, when you're
It's
having fun.
3 months. And so I know we started off with healthcare workers in the hospital setting and then expanded that to all healthcare workers. And then we started in the long-term care facilities. And so I think there was maybe some trepidation or anxiety about people being the first and being, the first people to get this quote new vaccine, despite this technology being developed over literally 20 years. And so we did see some lower than expected uptake. But we have seen that, with the nursing home staff that initially refused, with some of the healthcare workers, a lot of people were just like, I don't want to be first. But after they saw so many of their fellow coworkers and staff, get vaccinated, a lot of those people have come on subsequently. And so those numbers have picked up. We know we do have some lack of vaccine confidence or vaccine hesitancy, as you will, in certain specific communities. Sometimes this has been a phenomenon that's well understood and well described, especially in some of our African American and Latino populations. And so there have been lots of targeted outreach, working with religious leaders in those communities, outreaching directly to some of those populations, working even through Telemundo and Univision, some of those media outlets that reach those populations to really answer their questions, get over some of the misinformation that's out there, and be able to supplant that with the correct information. Our phrase is, once you get the facts, then we hope you'll get the vax. So continuous outreach is what we've been doing.
My question has to do with getting back together in person. Rotarians especially like to get together in person socially, professionally, and in our Rotary lives. What can you tell us about the restrictions for groups of, say, 25 more, 50 or more, even larger, 100?
Yeah, no, absolutely, sir. So Rotarians and everyone else who want to get back to being the social beings that we were created to be. And so I am really excited because for the last 3 weeks or so, I've been working with the team to come up for that next phase, the coming phases with larger size allowances and more things to be opened. And I don't want to get too far ahead of my boss and our leader in this great state, but we will have some exciting announcements this week on Thursday. But rest assured that we really, as we get more people vaccinated, as we have lower case rates, we have the lowest test positivity than we've had since the beginning of this pandemic. So that signifies that we can start making moves forward, allowing larger group sizes with the eventual, attainment of our quote phase 5 when we have the vaccine readily available. And again, we feel like we can be confident in moving forward as we've seen a good number of our seniors get vaccinated. And just to emphasize, 85% of all the deaths we saw here in Illinois were in individuals over 65. So yes, there's the chance for, sickness and maybe worse in others, but it was largely borne by our over 65. So we know that when we get them covered with vaccination, that we'll be in good stead and may not have every case of COVID gone, but can maybe still move safely forward.
Doctor, not only, Rotarians meet all over the world, and we do a lot of traveling. That's what we're used to do, to get together in some of our meetings. Can you bring us up to date on air travel, cruise travel, or even traveling overseas? What is the news in that regard?
Yeah, so of course we know that masking is required throughout all flights. It's required in every airport, bus terminal. So all modes of transportation are associated with universal masking. That's just the baseline. Right now, I don't know of an airline. I know airlines are talking about this, but I don't think there's an airline that has instituted proof of vaccination before getting on the plane. I don't think, I've heard that airlines are talking about this. I don't think anyone has implemented that. But we are, waiting to see, what will anyone go further. I know different countries have rules before you can enter their country that require a negative test before you try to enter their country. Many countries have a very significant quarantine process where you can't go past these certain hotels that are designated for quarantine for 14 days, after you come into the country, and then a test before you can move around in the country. I know many countries that have that already. So, again, before anyone is planning any travel, pay close attention to what the rules and regulations are in that country so that you can be in compliance.
I don't hear you saying that the state of Illinois has any plans along those lines with a health certificate that we may have to carry with us.
We have discussed, we wouldn't require it probably from the Department of Public Health, but I know that I wouldn't be opposed if there were businesses and establishments before they open up their massive convention center to 10,000 people. If they said, look, maybe we provide testing on site, or you have to bring, proof of a negative test or proof of vaccination, to us to make sure that we keep our event safe. So I think those conversations are happening at all levels with corporations, with convention planners, with airlines. So if we just go ahead and get our vaccine, we won't have to worry about it because we'll have whatever we need. And so that is a reminder that when people get the vaccine, there is a card that's given that's from the CDC that you have to, we're really encouraging people, take a picture of that as soon as you get it. That card could get lost, that card could end up in the pocket, go through the washing machine, get anything could happen to it. But if we can try to take a picture of that so you can save that documentation after you get that second dose. Again, remember, to have full vaccination, you have to have 2 doses if it's the Moderna and Pfizer, but 1 dose of the Johnson & Johnson vaccine.
That's right. Thank you, ma'am.
You spoke about the disproportionate impact on the elderly. And as a result, those in nursing homes and in other congregant living arrangements really have been isolated from their families. When do you think that might change?
No, that's an important question. We know that in addition to the really devastating toll in terms of hospitalization and death, we've also had the devastating effect of isolation in terms of people not being able to be in contact with the people that support them and love them the most. We actually did give guidance more than months ago, saying that if your facility is not actively in the midst of an outbreak and you're at least 2 weeks away from an outbreak, that you could open up to visitation. I know that a lot of our facilities are skilled nursing homes. After the trauma that they've been really reluctant to open up, especially if they find themselves in a situation where they've had no case in staff or resident for 2 weeks. I think they get palpitations at the thought of opening it up to visitors who could walk COVID right in the door again. So we actually this weekend, we're working on renewed guidance, trying to help these facility administrators come up with ways that they can feel comfortable. They need to know that if someone is vaccinated and wants to come into a COVID-free facility, that vaccinated person is not a risk, and so, we got to help them get there, but you have to remember that these administrators have been through so much. They've seen so many of their residents die, even their staff have succumbed to this virus. So they're going through their own form of, PTSD, but we also know how important it is for people to connect with their loved ones. And we're trying to help find a safe way to usher them back to opening their doors for safe visitation.
Thank you.
Dr. Ezike, besides the elderly, especially those in nursing homes, we saw a greater death rate, it seems, in certain of our populations, our Black populations, our Latinx populations. Has that improved now that we've had better treatment, and what was the cause of that to begin with?
No, great question. So we did see, and not just here, but nationally, we saw that the likelihood of being infected and the likelihood of dying was significantly higher, sometimes 2 times, 3 times higher in our Black and Latinx populations. And some of those reasons, I mean, everything is always compounded. There's many reasons, but some of the reasons involve the fact that a lot of people from the Black and Latinx populations are in service jobs, essential worker jobs, where they weren't afforded the opportunity to work from home. You can't drive a bus remotely, right? And you can't do a lot of these essential work, whether it's in a factory, whether it's in restaurants, whether it's in grocery stores, warehouses. That work put people in high risk of exposure from being in close contact with many people in the public, from having many workers in a small area. Many individuals from the Latinx population live in multi-generational homes where multiple large numbers of people live in the same setting. And so if one person was to get infected, it quickly could spread throughout that housing situation. So we have some of those as reasons, as well as some underlying conditions that are more prevalent, maybe because of lack of healthcare, maybe because of lack of access to healthier foods where there might be more obesity. So there's just a plethora of reasons why our Black and Latinx populations have been disproportionately affected. We have seen that narrow. Our governor has had always a keen eye on, mending disparities, closing such gaps. And so as soon as we identified that, we tried to make sure that more testing went to places that seemed to be disproportionately impacted. So earlier detection could hopefully portend a better outcome. And so as a result, we're trying to make sure that vaccine is pushed into areas that have been disproportionately hit, so that we can again work through that to try to close some of those gaps. So we are being very intentional about acknowledging how hard our Black and Latinx communities have been hit, and using that to really think about where we give the vaccine and which communities to prioritize for vaccine, knowing that everybody needs the vaccine, but we do have some ground to make up in terms of our Black and Latinx populations.
Doctor, one of the things we're hearing in the news lately is news about the variants that are starting to appear around the globe. And if we are in Illinois all safely vaccinated, are we still in danger for a new wave of a variant flu to come and still get us one way or the other?
No, of course, you're absolutely right. We can do all that we want in Illinois, but we don't have walls. We don't have walls around our state. And we know that this virus can fly. This virus can take cruise ships. This virus can take buses and trains. And so it's the virus and its mutants and its variants are just as close as the nearest terminal or airport that can bring it in. And so it is very important that we pay attention to what's happening. We have seen so far that the 3 vaccines that we do have, we think that they all still give protection against the main variants that we've been talking about. But we have to keep a close eye. There are variants that could develop tomorrow, and we have to keep an eye on that and make sure that those variants would also be handled by the vaccine. So we're following the research, our CDC and our World Health Organization. We're following information as it comes out. Again, this is a continually evolving situation. We have to continually follow the medical literature, but we know that the first step is to get as many people vaccinated as quickly as possible, and that is our best defense, even against the variants.
Thank you. Mhm.
Well, Dr. Ezike, we're getting close to 6:30. We've not finished all of our questions, but we do want to ask you one last one. What can the members of Rotary do to help?
No, thank you for that. We are always looking for partners. We have a community ambassador program. We know that many people who are in Illinois do not follow IDPH on their social media, but people get a lot of their information from social media. So if you're not looking at our website and aren't getting that good information, it could get supplanted by some misinformation. So we would love if Rotarians, if the club could be one of our community ambassadors, and as we share information about vaccines, about truths about the vaccines, updates, new information about the virus, if you could share that to your membership, that's another way for us to get the right information out. We really want everyone to be, quote, armed with the right information and then raise an arm to get that vaccine. So we could use all the help. We could use all the help that we can.
Great.
Very good.
Well, Dr. Ezike, we are so appreciative of you being with us. And I know before you go, because we know you're very busy, we wanted to present you with the Paul Harris Fellow Award. And I think if we can bring up the slides, Bruce. The Paul Harris Fellow Award is given to Rotarians, but for non-Rotarians, this is one of the highest awards that we can present. And we want to present it to you, Dr. Ezike, for all of your work that you have done to lead us in this pandemic, sometimes in uncharted waters, and finding our way, finding your way for us to follow. And we know that it really has taken, we oftentimes talk about the toll that it's taken on individuals, but I can't imagine the amount of hours, the time, the passion, the work that has gone on, the tears that have been shed, because it's really a 24/7 hour job that you've taken on, and for a year have given your all, beyond 100%. And we want to present you with this award.
I'm so humbled and honored. Thank you so very much for this distinguished honor. I'm very grateful.
And we also want to recognize Juana. Now, Juana Ballesteros has been with us, and she has gotten a few of us to be her ambassadors, and she has led us through the program, given us information so that we can share with our communities and with fellow Rotarians. So we also want to recognize Juana as well.
Thank you,
so
Juana.
much. Thank you. It's been quite an honor to do my part. Thank you.
And I know I speak for all Rotarians, Dr. Ezike, in thanking you for being here tonight, answering many questions that we had and really weren't quite sure of the answers, and also knowing that you're leading us through these tough times. And we know we're not to the finish line yet, but we know we'll get there with you and Juana by our sides. Thank you.
Thank you so much. Thank you so much. Thank you.
Thank you. And this now concludes our program for the evening. And I want to thank everyone that's been with us. As you heard, take that shot when it's your turn. Make sure you're helping others get the shot as well, driving them if they need a ride to their location, and also wearing your mask, keeping the physical distance, and practicing good hand hygiene. And avoid those St. Patrick's Day crowds this week. You can be there in spirit.
Absolutely.
Thank you and
Thank
good
you.
evening.
Thank you.